professionally but personally. Hello, everybody, and welcome back to the Kick Sugar Summit. And I have with me today Dr. Joy Jacobs. Oh my goodness, we're in for a treat because she's not just professionally but personally walked through the incredible depth and breadth of the problem called disordered eating and food addiction, sugar addiction. So let me tell you first about her professional credentials. She is a clinical psychologist in private practice. She is an assistant clinical professor at the UCSD School of Medicine. She's a published author who provides individual, family, and group therapy for individuals struggling with eating disorders. This includes anorexia, bulimia, binge eating, and also addictive eating issues. In addition to her extensive work in this recovery field, she is currently a coach and consultant with Brightline Eating and the Far House. We've done an interview with another member of the Far House. And Dr. Jacobs is a summa cum laude of Duke University and Harvard University. Welcome, Dr. Jacobs.
Thank you so much for having me.
Why don't we start by asking you the question of what led you into this area of expertise?
My own, as you mentioned, my own personal story really inspired me. I had suffered from eating disorders on and off from the age of 10 years old and struggled for about 15 years to find a solution, and ended up graduating from Harvard Law School deep in a struggle with bulimia, literally on death's door. And I decided that I had to really make my recovery first and take my life back. And that involved leaving the law for me and finding my passion, which I wasn't sure what it was. But when I fully recovered from my eating disorder within those couple of years, it became super clear to me that I had a calling to help people who had gone through what I had gone through and to save them so many years and years and years of suffering for them and their families.
Oh my gosh, I'm really shocked by the words "I recovered in 2 years." Like, that's incredible. What did you do?
Well, it was a matter of a couple of things. It was, number one, willingness, because I had hit such a deep, dark bottom that I was willing to take professional advice. And number two, finding the right professionals to work with. And I think as we were chatting before we started rolling our recording, I spent many years trying many paths for eating disorder recovery, which actually made me worse rather than better. And so I really had a distrust of treatment professionals by the time I actually hit my recovery. And I do believe it was kind of the universe finally conspiring in my favor in this recovery and connecting me with a nutritionist and a psychologist who put me on a meal plan, and it was a meal plan I trusted. And from there, my recovery was really rapid because I knew that I couldn't live that way anymore, the way that I was living.
The gift of desperation, as they say.
Absolutely.
Yeah, there's a moment I feel like where we break through the denial, and there's this primal fear, this is going to kill me. And it sounds like that's kind of where you were.
Absolutely.
Wow.
And my doctors were telling me the same. It wasn't just me, it became undeniable.
So with respect to what didn't work, do you want to tell us a little bit about all the things that you tried that didn't work? And
well, I can give you a quick summary. I don't want to take our whole session with that, but I do think it's important for people to understand that there is not a one-size-fits-all solution for eating disorders, for addictive eating. The paths can be different, but I tried psychodynamic psychotherapy, I tried nutrition counseling, I tried intuitive eating, and none of those things worked for me. In fact, they just accelerated the disease process that I was in my opinion, in retrospect.
Right, got it. So tell me a little bit more about how you define disordered eating. Like, how does somebody know if they're falling on that spectrum?
So, disordered eating and eating disorders are slightly different. Disordered eating involves typically having an obsession of some sort of food, with one's eating habits, that creates a lot of noise in the head, food noise, a lot of preoccupation. It requires a lot of time from someone's day, even if it's just mental time to manage their eating, and usually creates some sort of dysfunction in some area of someone's life, whether it affects their personal and social relationships, their health, their work, or all of the above. And I would say, a large percentage of people struggle in this day and age, struggle with some degree of disordered eating. We live in a really toxic food culture full of highly addictive foods. And it makes it really difficult, even for the average person who doesn't have a diagnosable eating disorder, to kind of navigate this landscape.
So, how important is it, and how does someone get a professional diagnosis of like disordered eating or an eating disorder or food addiction itself?
Right. I think it is helpful if someone is confused about what's happening with their eating to consult with some sort of professional, because even consulting with family and friends, it's hard to have that objectivity. And often people have their own struggles. So, what different people think is healthy and normal can be really variable. So, I do think it really is important to be evaluated by someone who's in a position to give, really educated, research-based feedback. Even many physicians have a very difficult time helping people with food addiction, eating disorders, disordered eating. It's not something that they're really trained in medical school to address, maybe more than a 15-minute lecture sometimes in an abnormal psych class, and it's usually more based on pharmacology. So I think it's really important to find, an eating disorder professional, and easier said than done sometimes, but looking through professional organizations or asking for a referral from your doctor or a trusted friend who maybe has walked the path is usually a great way to find a good professional in your area. And now, especially with so many of us working virtually, you can potentially have consultation with people outside of your region.
Hmm. And how many people, if you had to take a guess, and I don't know if we have firm research on this, how many people do you think actually struggle with disordered or an eating disorder?
It's been said that up to 5 to 10% of the population may have an eating disorder, a diagnosable eating disorder. I think a much larger percentage than that struggles with disordered eating. I can't give you the latest statistic on that, but probably 30 to 40% of the population has some issue with food. And as obesity rates are skyrocketing, um, that becomes more and more the case, because when people are stuck in a cycle of food addiction, it tends to progress with time. It's a progressive situation and condition, from my viewpoint, and the data does support that. So over time, those numbers are going up.
Right. And I just, those numbers seem way too low to me. I think that the
Mhm.
fact that 80% of women from the age of like 10 on are on a diet, and it can lead to chronic yo-yo dieting. I mean, it's insane food behaviors.
Absolutely.
Yeah. I think that the vast majority of us in some way or another are probably struggling with our relationship to our bodies and to food. And I don't know why those statistics, anyways, I'm shocked by those statistics. So, with respect to the difference between, one of the things that you and I were talking about was how intuitive eating sort of set us back. Because I used to read the Janine Roth books, right? And she was like,
Mhm.
just when you're hungry, eat what you want till you're satisfied and full. So the number of giant bowls of M&Ms I ate were gobsmacking, leading to migraines and depression and weight gain. And in fact, like just right, like it was terrible, and I was never going to stop. Like eventually, I had to realize I'm never not going to want to eat Black Forest cake for breakfast. Like I've got to find another way to get this sorted out. But in the
Mhm.
meantime, there wasn't a lot of awareness around the difference between like someone who's got an eating disorder or disordered eating and addiction. So do you want to tell us a bit about that?
Absolutely. And food addiction is still not widely recognized in the eating disorder treatment field. In fact, the majority of eating disorder professionals have the belief that food addiction is not real, that binge eating and addictive eating are a result of deprivation and restriction. And so, therefore, this is where the intuitive eating model comes from, the idea that if we give ourselves permission to eat what our body is asking for, that we will no longer have that need to binge because we have permission. We know we're allowed to have this food any time of day, any day of the week, right? Black Forest cake for breakfast, no problem. Listen to your body's cravings. What that completely ignores is the science of addiction, the neuropsychology of addiction, how we know sugar affects the brain and our behavior, and the manufacturing of industrial addictive foods that are designed to make you addicted to them. And so intuitive eating in that kind of environment is a really tough ask. And, I advise anyone, if they're struggling with their food, try to eat intuitively at first. See if it works for you. Wouldn't we all love to eat intuitively and be able to eat whatever our body craves in the right amount at the right time and move on? But for those with serious eating disorders and food addiction, that is a disastrous path because it does not have the structure that someone needs to actually recover from their conditions.
Yes, amazing. And what are some of the supported or researched or empirically documented approaches, treatments for eating disorders? Like what actually works?
Okay, cognitive behavioral therapy is kind of a standard, is effective for the treatment of eating disorders. Also, we're getting more research as to the efficacy and helpfulness of dialectical behavioral therapy, which is an offshoot of CBT. And then for children and teenagers with eating disorders, there's something called, it used to be called the Maudsley approach. Now it's called family-based treatment for eating disorders. And I was one of the first people certified to deliver this treatment. It's the treatment that I wish I had had as a child, because I probably wouldn't have struggled for 15 years. And what it involves is the parents basically modeling at home what would happen on an inpatient treatment unit in a hospital in terms of delivering meals to their child, supervising the meals. But the benefit is that the parents get to choose the foods that the child eats versus a hospital deciding. And that's for anorexia. FBT is specific to anorexia nervosa. For bulimia nervosa and binge eating disorder, cognitive behavioral therapy are very effective. So the benefit of FBT for children and adolescents is that they get to stay home and in their environment, and they don't have then the additional trauma of being hospitalized, missing school, and all the things that come with that.
Yeah.
So, I mean, for people who suffer from severe food addiction, an abstinence-based model is very helpful, and that is a very unpopular statement in the eating disorders field. But there are some people who will never, no matter how much CBT and DBT and interpersonal psychotherapy they have and how much trauma work they do, if they're continuing to put addictive substances in their body like flour and sugar, some brains react to flour and to sugar as if they were, other addictive substances like cocaine or heroin. They will not recover no matter how much therapy they do if they continue to eat those foods, because their brain continues to be overstimulated. And ultimately, what happens is called dopamine downregulation, where the brain needs more and more of these foods to get the same effect or similar effect, which doesn't even happen. It's a similar process to drug and alcohol addiction that happens in the brain. So an abstinence-based model can be very helpful in those situations.
And by abstinence, do you really mean like never again? Like I can never have sugar and flour again, not even a bite, not even on my 50th birthday party?
I think it can be daunting to think about it in those terms. Ultimately, that may be what it looks like. But I really advise my clients to take things one day at a time, one meal at a time, and to move in if they I don't necessarily start every eating disorder patient with an abstinence based model. The opposite. We try to include all kinds of foods that they can eat, and we build a structured meal plan and we see how that goes. And if that's not working, if they continue to fall into problems when they have foods that contain sugar, high amounts of sugar, for example, we might consider an experiment of removing sugar from their diet, for example, for a period of time to see how they do. So I encourage people to start it with an attitude of curiosity and experimentation. And when people get relief after that period of abstinence, generally they don't want to go back to what they were doing before if they're finding relief from their binge eating, from their bulimia, by reducing the exposures to these triggers. It becomes almost something that they want to do versus something they feel like they have to do. But ultimately, if someone is truly addicted to sugar or flour or any other substance, long-term abstinence is going to be required to maintain that recovery.
Right. And have you found that there's other trigger foods that for people who are sugar addicts, that over time as they get curious and they experiment to see what's triggering them, what seems to create relapses or cravings or food obsession, have you found it's just sugar, flour, or is there more?
I think many of the very salty foods or highly flavorful foods can be very activating for the brain. And so people can get into trouble with things like popcorn, right? Like something very simple like that people are told to eat if they want to have a healthy eating plan. Have popcorn as a snack. Well, some people can't really handle that if it's full of butter and salt. So I think highly flavorful foods of any kind can be problematic for people, but the two biggest culprits truly are those that contain flour and sugar. And artificial sweeteners are a problem. So people's sugar addiction, even if they've been abstinent from sugar per se, but they're using artificial sweeteners, their brain will respond as if they're eating sugar and can keep that cycle of addiction going. So that's something that gets removed with the flour and sugar for people who are wanting to experiment with that.
So I hear all the time, but what about stevia? What about monk fruit? What would you say to that?
I think stevia, monk fruit, any of these sweeteners are not going to be helpful in bringing healing to the brain because they are creating the sweet sensation is what the brain is looking for. So regardless of the source, the same goes with honey and maple syrup and these things that are in many, very like healthy recipes that are alternatives to refined sugar. But in some ways, the brain and the body respond to those substances in a similar way that they would to pure sugar. And so anything that's really super sweet is going to be triggering to someone who has a sugar addiction.
Right. It's hard to imagine, right? Because you just think, okay, I'll give up the white stuff, but don't, I just want to have a little bit of stevia in my protein powder, or, and it can keep people sort of tripped up for years.
Absolutely. And it doesn't have to be, some people like to go into things like with both feet and do extreme things and right away. But some people, especially those who struggle with disordered eating, might do better at taking things more gradually. Like maybe week 1, I'm going to get rid of like all refined sugar. Week 2, I'm going to do artificial sweeteners, or maybe month 2, just to feel like they have a way to transition into more of a full abstinence kind of situation without feeling really just incapable of managing it. And ultimately that gets people kind of on the road to trying new things and creating new habits and behaviors that ultimately become so reinforcing that it doesn't take a lot of willpower or determination to maintain those once they're in place.
Right, right. And have you found in your practice of many years, many, many, many years now, that there are anorexics that fall on the food addiction spectrum? I'll back up slightly. I have a friend, my best friend's daughter, um, is struggling with anorexia, and they did the FBT approach where she was home and they fed her and it was on a schedule and it was like every 2 or 3 hours, and but the hospital told her, my friend and her husband and their family, that there are no foods off limits. There's no such thing as bad foods. That you feed her crappy cereals, you give her like the whole. You have to undo the damage you've done by giving her the message that some foods are healthy and others are not.
Mm-hmm.
So she kind of, you know. My husband, more than my friend Pam, were just horrified because he eats really healthy.
Yeah.
And so, and I don't know if maybe there are individuals that are, I mean, I'm assuming there's individuals that are anorexic that are not on the addiction spectrum, that is exactly the path to recovery for them. But what about these anorexics that are also on the addiction spectrum and are constantly being exposed to foods that create cravings and food obsession and like brain crashes? And what do you have to say about that?
I mean, I was definitely one of those people as a 10-year-old, as a 17-year-old, as a 24-year-old. And I completely empathize with that situation because in eating disorder treatment, actually, if you're at in a residential kind of setting, if you refuse to eat things with sugar in them, you will be it will be a punitive situation that you're in where you don't get to see your family, you lose visiting privileges, you're required to eat even more food because you refuse to eat, the dessert or whatever. So I think there are definitely people who have a diagnosis of anorexia nervosa that also have food addiction. And the key to those people when I work with them individually is I always start people out with an approach that includes all foods, including foods that include sugar, because we need to kind of rule out, and they kind of need to prove to me that they have food addiction and sugar addiction if someone has anorexia, because there are a lot of reasons that people give to avoid eating with anorexia. And so that may be a partial reason for the anorexia in the first place. I know for myself personally and many of my clients, there becomes such a fear of food because of the food addiction and the sugar addiction that people just stop eating altogether because that feels safer than trying to manage their intake of these foods that are full of sugar. And so that may be what happened with your friend's daughter, but it's hard to say. So I think if someone is going to take an approach in terms of recovery from anorexia in particular and take a food addiction kind of abstinence model approach, it's going to have to be very carefully done and very supervised, and there needs to be an abundant amount of food included in that plan. It just happens to be food that doesn't have sugar in it. So lots of healthy fats, eating grains, unprocessed grains, lots of protein, lots of fruits and vegetables. And, ultimately it's a little bit harder to restore weight when you're including foods that don't have sugar, because those foods, you can get a lot of kind of calorie density for your buck in a sense. And so that's why another reason why they're kind of favored in eating disorder recovery for people who are underweight or in a restrictive kind of eating disorder, because it can kind of help with weight restoration pretty quickly, but ultimately it can lead to a lot of suffering as well, because these people, these patients, I know I beat myself up, like, why can't I succeed at this intuitive eating? Why can't I manage my intake of these certain kinds of foods that are really sugary? And for me, it was because I had an addicted brain, and I didn't even find that out till I ended up many years later. I was able for many years to kind of manage my food and do just fine, but I had some medical issues and I was required to go sugar free. And that was the first real complete relief I had. And it was by accident. And that's when I started pursuing this as an approach for my own patients, because I didn't realize as an eating disorder professional, I was trained to believe that restricting any food is pathological and a sign of disordered eating. And I believed that, and that's what I did in my practice. I mean, I never forced a particular food on a patient, but it was the model that I worked in. And when I had my first experience of exploring abstinence from sugar, it was like a miracle. It happened, and it wasn't one that I was really looking for. And so it really opened my eyes to the possibilities of this in a whole new way from personal experience.
And when did that happen for you? Like, how long ago was that?
That was about 7 years ago. So in the course of my career, midway through my career.
So you actually literally felt like you'd had recovery over 2 years.
Hmm.
Recovery from like anorexia, I'm guessing then.
And bulimia, and there was a whole mix. Yes.
So binge, bulimia, and anorexia was part of the mix.
Right.
And you felt like you got recovery from that, but it wasn't until 7 years ago that you felt like the last piece, the recovery around addiction. How did you get recovery without addressing the addiction piece? Like, were you not still
For me, it was manageable. Like, I loved fat-free frozen yogurt, and that would be like my dessert, and it fit into my overall meal plan. And it somehow, I always kept that structure that I got early on in my recovery of having a template for my day of what I was going to eat and when, because I found that that worked really well for me. But, I always was tempted to like, oh, maybe I could skip what I planned for lunch and have some frozen yogurt instead. I love it so much. And that's not an eating disorder. That could be a poor food choice, but that's not, you could still be in recovery from an eating disorder and make those kind of choices. And it was only when I just decided to be sugar free for these health reasons that I had complete relief from cravings and having to like manage so much with my food, if that makes sense.
It does.
Yeah.
Yes, because that was the thing that struck me when you said, and I know addictions are progressive, and I am a 10 out of 10 on the addiction spectrum. But I found that over time, I ate sugar all day long as a kid,
Mhm.
breakfast, lunch, and dinner. Got into university, pizza, like just crab dinner, garbage, pop,
Right.
brownies all day long. And no kidding, I crashed. And I was desperate for solutions, and I started to clean up my diet. And it took quite a while because this was really early days. There were very few books and no one to turn to really to talk about the fact that I was a hardcore sugar addict and dying, rapidly committing suicide. And I figured out how to get better with my diet, right? Like to make start smarter sugar swaps like honey and maple syrup only, and I got rid of flour, and I got rid of wheat, and I got rid of all gluten, and I got rid of dairy. Like, I just muddled my own way through, and it looked like it was getting better. My food choices were getting better. I was being more peaceful. My migraines had turned around. Like, I'd lost weight, 45 pounds. Like, good things were happening. So it looked like I was progressing in the right directions in terms of recovery. But the addiction itself was not, right. So it looks like we can that's the deceptive part, is sometimes it looks like we can manage, we can almost be normal eaters, but it's
Right.
still there. And it sounds like that was happening for you too.
Absolutely.
Yeah. And that's the deceptive part, isn't it? Because I have clients that'll say, you know what, I had a little bit of birthday cake, and it was just like, it was a small slice, and I was fine. I was fine. I didn't even crave anything the next day, and that's it's like the brain's evidence. See, I'm not an addict. I don't need to do perfect abstinence. Can you
Right.
speak to that? Because I know that's one of the hurdles we have on our path to recovery, isn't it?
Absolutely. And I believe helpful from a professional. I mean, diagnosis from a professional is very helpful, but ultimately this has to be self-diagnosed on some level, because to have the state of surrender required to choose long-term abstinence requires that you absolutely be convinced that there's not another path for you. And so some people do require more experimentation. And so it's almost like as helping professionals in this field, you and I may face resistance from people where they need to prove that they actually don't have the addiction. So I allow clients to experiment, because that's, to me, when they have a failed experiment with eating even small amounts of these foods, then that's more data for them to have to actually convince them of one path versus another. So I think that ultimately the buy-in is much greater when people try and fail, because then they realize that they are on the right path. And it's difficult to stay on that path, and people want to make exceptions, and they have to see kind of for themselves oftentimes that it just overall increases their suffering in the end. And we want to spare them that pain, but truly that experiential learning of personal experience cannot be replaced. So I try to hold people in a space of compassion, but I also say, when in doubt, play it out. So if you decide that you're going to make an exception for this wedding or the birthday or the office party, what does that look like for you later today? What does it look like for you next week? What does it look like a month from now? So they can really kind of trace back into their history. How have situations like that worked for them in the past, and why is now different? That can be really a really helpful activity to do.
Have you ever seen somebody who sort of, seemed pretty solidly on the addiction spectrum be able to go back and moderate?
No. No.
Yeah, interesting. That's every addict's hope.
Absolutely. And
Yeah.
this is when I bring up the cucumber and the pickle idea, where if you're a cucumber, you're a cucumber, but if you're a pickle, you can't go back to being a cucumber. So if you have addiction of any sort, you are a pickle. And as much as you may want and dream to be a cucumber again, it's not going to happen. So, let's be the best pickle we can be. It sounds a little bit silly, but it can be helpful, because it's like we want to be something that day has passed, right? The time when our brain was unpolluted enough to be able to tolerate those substances has passed, usually by the time someone's coming to someone like us for help.
Yes. And in terms of your journey, once you discovered, oh my goodness, for health reasons, I did this experiment of being off sugar. I felt so much better, freedom around cravings. I didn't feel like I had to, grind and fight the same way to stay on on the good path with my food structure. Did you have some relapses? Like, what was your journey through that last little part of your own healing journey? Or did you get it and that was it?
No, I think there were moments of like, okay, I'm done with this medical protocol, so now I can start to have some of those, favorite foods again. And I noticed when I had those foods, I felt awful. And that the moment that I started eating those foods, then I wanted to have them every day. And I could see how it was escalating. And that's when I really put it all together, and felt a deep belief on a personal level in the food addiction model for me. I never really questioned anyone else's experience with food addiction. I believe that food addiction is real. In addition to just sugar addiction, I believe that compulsive eating is real. I believe, in the field, they say, oh, well, food can't be addictive. We require it to live, so therefore it can't be addictive. That is not a convincing model for why food addiction is not real. And so this is why food addiction is among the most difficult to treat and manage, because we do have to eat and live. We can decide to be fully abstinent from, alcohol, from drugs, and we can live just fine without those things. But all of us have to face food multiple times a day, every day. The TV is full of ads for different foods. We have to go to the grocery store. It's a social medium as well. There are so many components that make this, in my opinion, one of the most difficult conditions to navigate.
Absolutely. And what is the harm in someone saying, okay, I admit I'm probably on the addiction spectrum, but I'm going to do my best to moderate?
Mm-hmm. I think it's a personal choice ultimately. the harm for them is, does it get to a point where their blood sugars get out of control, they develop diabetes and other health conditions related to their sugar intake, obesity, all kinds of complications that happen from just deciding to manage. And some people need to do that for a period of time. Like, I believe that timing is a really important kind of component of recovery, and you have to have or be willing to make the emotional space, the space in your life to dedicate work to recovery. And especially in the early stages, it's a lot of work. But you know what? It's also a lot of work to stay stuck in addiction, and how much time and effort to get those foods, to eat the foods, the recovering after all of it isn't tremendously work intensive in its own way. And sometimes, someone like us, we can be helpful in helping people see those other perspectives and seeing what the benefits might be of getting relief from that in their life.
Right, right. And I've noticed that as I've been walking my own journey of recovery, that I thought at first that if I could just get abstinent, oh, that would be so helpful. My migraines would disappear, my moods, and I know my moods are more resilient, I'm happier, I'm healthier, all those good things. And I thought that I was kind of done. That I thought the end goal of recovery was actually to get sugar free and to stay sugar free, that was the point of recovery. And then the further along the path, you realize, oh, no. Abstinence is a tool of recovery. It's the foundation of recovery, right? It just begins after you're able to put the food down successfully, peacefully, in perpetuity, with a grateful heart. And that begins the journey of recovery. And then that's when I discovered, oh my goodness, there's trauma, there's maladaptive stress management. I don't have any clue how to really live in life without sugar because I always had my go-to. It was convenient and it was effective. Right. So tell us a bit more about life after sugar and what kind of tools and skills and experiences you offer, both personally, your personal experience and your professional, wearing your professional hat.
Yeah. So, I view addiction as a threefold disease: physical, emotional, and spiritual. And so I believe that all three elements need to be addressed in any kind of recovery approach from food addiction and eating disorders. So, the physical piece we take care of potentially through abstinence, through a meal plan, through working with people around our food specifically. The emotional part of it is by talking about it, learning new skills for coping with stress, right? Stress management, managing your nervous system, dealing with trauma. Often depression and anxiety are part of the picture. All of that needs to be addressed in the emotional component. And we can do that through therapies like CBT and DBT, through meditation, EFT. There are a lot of practices that I incorporate to help people on that level. And then the spiritual is like finding that greater purpose for our lives, right? And finding the spiritual healing. Most people who, by the time they go into recovery from any sort of addiction, are really beaten up. They have a lot of feelings of isolation, shame, guilt, regret, abandonment, all of that. And so I believe that the mind techniques, they can take us to a certain level, but then we have to bring in the spiritual, and that's going to mean different things for different people. For some people, it might be a 12-step program. For others, it might be getting really involved in their church or synagogue, or, some other religious kind of affiliation. For other people, they might find that in yoga. Some people might find that spiritual relief in meditation. There are many different ways for that to take shape, but I believe that truly, and service to others, helping others recover from something that you're in recovery from, and being a support for others can really be beneficial on a spiritual level. But I do believe that all three components need to be addressed for recovery to feel good, because having a white knuckling abstinence, willpower driven recovery, and like that's the tool, is willpower, is going to ultimately not be long lasting for most people because it's just too draining. So I think really addressing all three components is crucial.
Yes. Oh, absolutely. And talk a little bit about the connection between men and women who struggle with food. and sugar overconsumption and sugar addiction and trauma. What have you seen, or what's the research on that?
You know, it's really interesting. Many, many people who struggle with addiction do have a trauma background, and there's definitely a correlation between the two. Now, is there a causation? That's an open question because there's also a lot of genetic research now showing truly DNA, genetic based susceptibilities to eating disorders, to drug and alcohol addiction, to all kinds of addiction. And so, what I tell my clients is it's like our genetics give us our foundation, and then environmental triggers like trauma can kind of like pull the trigger on the disease. There's something called the diathesis stress model. And so the diathesis in some way is this genetic makeup that people have. The stress could be something like trauma that actually like pulls the trigger to bring that disease to life. I want to share something about trauma, and I think that this is really important for people to understand. And this is a myth, and I know in the eating disorders world for many years. The idea was that you had to kind of resolve all of your trauma and heal all of these childhood wounds in order to recover from your eating disorder or food addiction. And that is just not the truth. So the great news is there are strategies and techniques that you can do to get your food under control while you do that work healing the trauma. But your recovery is not conditional upon that trauma work being complete, because you could spend decades trying to heal that trauma and also you need to continue to suffer with your food, and that's just not the truth. And so the great news is that one doesn't depend on the other.
Oh, beautiful. Yeah, the healing can happen in tandem. In fact, don't most of us think that abstinence first, recovery second, right? Like, let's just get the food sorted, and so that you've got the brain power, the bandwidth, the energy.
Absolutely.
Let's get practical here for a little bit. Maybe we could sort of end the bit of the interview with some, like, what are some practical tools and tips? Like, if you do still in your day-to-day life ever get triggered back to thoughts of wanting to eat sugar, and how do you handle that? Like, what are some of practical things that people can take away from this interview that they can start to implement in terms of getting space from the impulse to binge eat or purge or eat sugar?
Okay, great question. I think there's so much power in the pause and just being mindful and going slowly when it comes to food. So, particularly for people who struggle with impulsive eating, just where they end up eating something that they didn't plan on eating, usually something that's very sugary, and they're like, how did that happen? Like, I don't even know what happened. I was thinking that I was having a great day, and now I'm totally derailed. And so, for people like that, I encourage people to build in a ritual that they do every time before they eat, before any bite of food. They do this ritual. It might be a prayer of gratitude. It might be taking 3 deep breaths. It might be making sure that you're sitting. Just have something that you do before you eat any bite of food ever, because that immediately creates a pause and allows you to slow down and actually think about and be aware of what you're eating. It might sound a little silly, but it truly does work. And I think when you find your mind, a lot of us will find our mind in a fantasy mode about some food that we see or we think we want to eat and we know it's not good for us. And I think getting really honest about what happens to us when we eat those foods is helpful. So I encourage people to write down the truth of what happens when I give in, when I eat this food, when I violate my abstinence, when I go for that thing that I know is ultimately not going to be good for me. How do I feel? What happens? Do I want more? Do I feel satisfied, or am I craving for the next hit? And I think getting really clear about what actually happens to us is really helpful because we can be in, in addiction, we often are in fantasy as if our brains are just like everyone else and we can have a little bit of something and be just fine. And that's why I think it's really, really helpful to really pay attention to your own personal truth. And then planning. If you know that you're going to either a place or an event or something where there's going to be a lot of these foods that are triggering for you, have a plan in place of what you're going to eat. If you're going to a restaurant, look at the menu ahead of time so you can get clear on what your foods are. And have people who are, I think it's really helpful to have running buddies, people who are in this process with you that you could text or call if you're feeling vulnerable and actually doing that. A lot of people have the intention that they'll reach out for support, but don't actually do it. And it can be such a life-changing thing to do.
Wonderful. What do you do what sort of ritual do you have around the pause in your life? Personally.
I don't eat standing ever. I always make sure that I'm sitting. I personally like to make sure that meal times are peaceful. So, when my children were very young, I would often feed them. And then as they were like at the table eating their food, then I would come with my own food and eat it with them. But I would make sure they were taken care of first because that allowed me to just be more mindful in my eating. And I think that the breaths are something that are a real staple of mine, of just making sure I check in with my breath and I'm in a calm space whenever I'm in a situation where I'm going to be eating, because I find that when, stress eating is a real thing and using food as a coping mechanism is a real thing. And so I think it's really important to kind of break the connection between stress management and eating. And the breath is a really always available, powerful tool for that.
Oh, so yeah, exactly. Free too.
Exactly.
What happens for individuals that they're on the path, they're doing great, they've got long stretches now of being binge free, of being sugar free, and they're starting to feel hope, and then something emotionally triggers them, and it's really intense, and they feel like their back's up against the wall, and that that they have to eat. It's just the swamping, I guess, emotionally of the nervous system. What would you suggest in that moment? And maybe it's no different, but is there anything else you would add in those moments?
I think to really, again, slowing down is one of the most powerful techniques. Set a timer for 15 minutes and tell yourself you can eat whatever you want in 15 minutes if you still really want to eat that thing. And then you have the time to hopefully you have some sort of emergency action plan in place for situations like that. Things that you're going to do when you're feeling stressed out and like you need to eat. Because ultimately we know that food is not going to solve any problem that we have. It might numb us from it for a period of time, but really typically spirals and creates more problems. So I think the key is to slow down long enough, again, to use that emergency action plan and ultimately to have that true knowing that food unfortunately won't fix most of our problems, right? And so once we have that clarity and surrender around that, and we have other coping mechanisms that we can use. And that sometimes takes time to build up a kind of repertoire of things that we know to do when we're feeling super stressed out. But getting outside, getting into nature, calling a friend, hitting pillows, going to sleep, all of those things are probably going to be far more beneficial than eating over it.
Amazing. Wonderful. So let's talk a little bit about weighing and measuring. So what has been your personal and professional experience of the value of that and the risks of doing it? Like, what are your thoughts on that?
Okay, great question. For some people, the idea of weighing and measuring their food sounds extremely, almost draconian, restrictive, very eating disordered. But what's true is that most people with eating disorders truly struggle to self-regulate when it comes to food and to know what the right amounts of each food are for their body. So it can be really helpful to weigh and measure food maybe your dietitian or a professional that you're working with needs to tell you what the amounts are that are really appropriate for you. But it can bring tremendous freedom because it takes the guesswork out of figuring out what you're supposed to eat and how much of it. That said, the idea of weighing and measuring for those who do have, especially, a restrictive eating disorder history, can take them back to like the hell of feeling like they were starving on whatever diet that they were on. And so in that situation, I suggest just knowing how much you're going to eat ahead of time, like how much of each food is going to take up on your plate or the bowl that you're using, so that you're not on the fly trying to decide how much to have. And so it's really highly individual, and it can depend, even it can change within one person, right? As we were talking about, like sometimes it feels great to weigh and measure, and sometimes it feels more healthy to use what we call the one plate rule, where we fill our foods on our plate and we stick to one plate and then we're done. So for in restaurant situations, a lot of people prefer to use the one plate rule that rather than trying to weigh and measure their food. But I think that staying consistent from one day to the next with your portion sizes is really important and healthy in eating disorder and food addiction recovery. Because again, once we start getting into gray areas with our food, we can feel really lost and easily kind of susceptible to chaotic eating.
Oh my gosh, that's a brilliant answer. And I love that you've given us 3 different ways that if we don't want to like pull out the scale, that's really triggering, it feels too much, then we can just have a really clear idea beforehand. How much chicken roughly am I going to have? How much broccoli or salad or whatever. So you have an idea beforehand, and then you just serve that and you sit and you eat it. I love that, as opposed to sort of finishing a meal and going, am I complete? Was that enough? Because that's where things go off the sideways, don't they?
Absolutely. That family style eating can be really difficult for people who struggle with eating disorders and food addiction. And I don't recommend it, at least for a period of time until you've kind of built up your confidence that you know how to manage your food intake and you're clear on what your boundaries are with food.
Are there any final words of wisdom you would like to share with us today on the topic of sugar and sugar addiction?
I'd just like to give a message of hope, because I know there are so many people out there who may have been struggling with food and with sugar their entire lives, to understand that, yeah, there may be some discomfort in the early stages of recovery, but that is temporary, and that the rewards that come from it are just really beyond description with words. And also, a lot of us tend to be perfectionists, and a little slip doesn't have to be a major disaster. You can get on track immediately. You don't have to, if you've had a slip, that doesn't mean that the solution is to, binge for the rest of the day today and start over again tomorrow. I've seen that get people into, weeks and months and years of relapse. So I think that the message is to just try to course correct as soon as possible, because you can use that slip as an opportunity to learn and figure out what you could do differently next time, and to just keep showing up and keep showing up and continue to learn and grow and be vulnerable. And with that, I believe recovery is possible.
Thank you so much. Thank you for your time. Thank you for your work. I really appreciate it.
Thank you so much for having me. It's been such a gift.
Bye, everybody. We hope you enjoyed this interview. And before you go, do one thing. Stop, think back on the interview while it's fresh in your mind, and write down your favorite takeaways in a special dedicated journal. If you do this at the end